In looking at the overview of an IVF process, it typically takes approximately 3 menstrual cycles from start to finish. The first menstrual cycle worth of time is creating the embryos. That's doing the egg retrieval and doing the embryology to make the embryos and any genetic testing. The second menstrual cycle is what we call a mock cycle. It's a practice embryo transfer. Then the third menstrual cycle is the real deal, where we transfer the embryo and go into pregnancy. With the first part of this process, getting the embryos, the way that we do that is through an egg retrieval. A woman goes through approximately 2 weeks worth of medications, goes through a procedure at the end of it in order to extract or remove the eggs. She's asleep for that, so she doesn't feel anything. And then the eggs and the sperm go to the laboratory, where it takes approximately 1 week to get the embryos created. And then if they decide to do extra genetic testing after that, that typically takes another 1.5 to 2 weeks or so to get those results. The next part of this process is what we call the mock cycle. This is a practice embryo transfer with the intent to make sure that everything we can straighten out before the real deal of the actual embryo transfer is good. You take the medications, we watch to make sure that the lining thickens up appropriately and that it has the changes that it needs to based on what medications you are receiving. And then we do a practice embryo transfer with an empty catheter to make sure that the path is easy to traverse before we do the real transfer. The third part of this process is the actual embryo transfer. We have you take medications to thicken up the lining of your uterus, watching even more closely to make sure that the hormone levels and ultrasounds look appropriate. And then on the day of transfer, we will put back 1 embryo at a time, usually, and make sure that it goes in the appropriate place in the uterus. After a positive pregnancy test that we check by blood work, we are going to follow blood levels to make sure that they are rising appropriately. And then as soon as we can, and as soon as we expect to see something in the uterus, we start ultrasounds. We then monitor by ultrasound and blood work what your levels are and how the pregnancy is growing until approximately the end of the first trimester, roughly 10 to 12 weeks of gestational age. At that point, you graduate from us and go to your OB for the rest of your pregnancy.